So my name is Brandon. I'm a physical therapist here with Benchmark Physical Therapy, and we've got 13 locations here in Central Kentucky. We are currently in our Hamburg office. We're next to LensCrafters here off Sir Barton Way.
Which is how far away from my office?
Oh gosh, footsteps, right?
Yeah.
I think we're less than a mile away from you. We have a convenient location here, so it's easy to get in and out of our clinic. The parking lot is steps away from you. We have the ability to get your patients in within 24 to 48 hours. So if you need somebody desperately to get in, especially if we're trying to get people in before the weekend, we can get those patients in. I think what's unique about us or different is that we don't have assistants in our clinics. So you see the physical therapist when you come to see us. And we feel strongly, our physical therapists now have to go through a 7-year program. They have to get their doctorate to become a physical therapist. So 4 years of undergrad, 3 years of a doctorate program.
Wow.
And so they're the people that are highly trained to be able to take care of patients. And so we feel that that's important. Not to discredit assistants, but those are 2 years degrees, and it just can't match what a 7-year degree, a doctorate level clinician can provide.
So I always thought assistants were on their way to become doctorates.
No.
Oh wow.
So
Mythbuster.
It's a 2-year associate degree typically that assistants get, and don't get me wrong, there are great PTAs, the great assistants that are out there. That have a lot of skills, and they've been doing it for 10 to 15 years. But our entry-level assistants that come out of school, it's going to take them a while to catch back up to what a physical therapist can do. Plus, there's limitations. Those PTAs can't do dry needling, so our physical therapists can do dry needling, and we have clinicians that are certified to do that. Of course, an assistant can do an assessment with a patient. They can't do an initial eval. And I think what the shift for us with that is, it's important for us to build the therapeutic alliance, is what we call. And we try to create a therapist for life mentality. We want to take care of people throughout any condition that they have. So while you may send us a foot ankle patient, down the road they may have a shoulder injury. And if we've built that relationship with them and we've connected on that front, they're going to come back to see us for that as well.
I've talked to some physical therapists that really don't like lower extremity. They don't like the feet. I don't know what it is, but is that something you guys are comfortable with doing? And I have talked to other physical therapists, like, we specialize in this. Kind of, where do you fall in that? Yeah,
so myself, I'm a board certified orthopedic clinical specialist. So less than 10% of physical therapists go on to get a board certification. That's something that you do outside of getting your licensure. You can choose to do a residency program to be able to be a part of that. So I think that differentiates myself in terms of being a clinician and treating orthopedic injuries, especially foot injuries. My philosophies with the feet is that it's not just the feet that we need to treat. We need to look up the chain too and make sure that the whole kinetic chain gets addressed. So we treat a variety of conditions, the plantar fasciitis, the Achilles tendinopathies, any type of toe injuries, if we're seeing hallux valgus or any type of toe bunions, you got it. So it's important in working with you and seeing kind of what you're assessing, if that person needs footwear changes, if they need strengthening, if they need mobility and stretches, that we're working comprehensively to address those things. Sometimes we do a gait analysis with the patient too, so we have the ability to slow down what they're doing and really look at the foot and understand the mechanics that are there. I feel definitely comfortable.
When I started practicing, I had no idea that how much hip weakness contributes to, say, something like tarsal tunnel syndrome or foot pain in general. So I always send PT. I'm like, hey, look at the hips, make sure that they're strong, because I don't know what I'm doing in terms of that. I can just tell it's off, and this hip's doing this, and this shoulder, yada yada. But it's incredible how it's all literally connected. Just like the song from when we were in grade school. The hip bone's connected to the knee bone, connected. So it's really like true. So I love that you guys do the gait analysis. That's huge. A lot of patients do not like to hang out in physical therapy. I'm sorry to tell you. But I have a friend, I told him I was coming here, and he was like, I hate going to my physical therapist. I love him as a person, but I can do this stuff at home.
Absolutely.
It's a waste of my time to go do it. So what would you guys do differently that would be kind of manual here as opposed to someone like going home to do it themselves?
Yeah, so we recommend intensive therapy early on because our goals are really to get you back home to doing things at home. So when I evaluate a patient, I determine how long they need to be here, how often they need to be here. It really is that, how much hands-on care am I going to have to provide to this person, because they just can't do the things that I can do at home. So that's the first step in determining that. And then, typically I'll see patients earlier in the beginning stages, and then I taper them down because my goals are, as you learn how to be independent with these exercises, I want to make sure you're doing them the correct way. But yes, the goals are to be there. As you see with our clinic, we don't have a whole lot of fancy equipment here. Most of our patients don't have fancy equipment when they go home. So how can I teach them to be independent with their stretches, with their strengthening, and make sure that they're doing them the right way to gain that independence over time? And of course, we check in with them afterwards. A lot of times we'll put people on hold after they finish the plan of care and just let them live life for a little bit. They call me if they need me, and we reassess them and see how things are going. Sometimes people like to do checkups periodically too, and just say, hey, where am I at? How's things going? We get that. We understand that it is a time commitment for people to do therapy, and it takes a big chunk of their day. But yes, how can we get them independent? And that long-term success, if they're depending on me to do passive things with them all the time, they'll never really get away from that.
I like that philosophy.
So how can I get them to be independent with it?
Speaking of time and how much it's taking, what are your hours here?
So we're open from 8 to 5 in this clinic. We understand that some people work, right? And they need other availability. So we're willing to work with people on that too. So if somebody we've evaluated says, I don't get off work until 5, we have flexibility where we can work that person in and make sure a clinician can see them.
That's amazing. That is truly amazing. And I like, we're here and it's not busy. Sometimes I walk into a PT clinic and there's 20 different people in there. It's very hectic. I feel like this will be kind of like a private, almost physical therapy session. How many, so you're here obviously, how many people max would be in here for? And what's your demographic?
So right now, typically there's no more than 3 people in here at a time. I think what's nice about this type of setting is I get to pick and choose who I see and when I see them. And so I would never schedule 2 patients together that I know I need to do a lot of hands-on work with. It may be that person that, one person needs a lot of hands-on work with, and maybe somebody's already pretty far progressed in their rehab and they don't require as much attention for me. So that's one thing. And I do think that you're right. This type of setting, this smaller setting, you get to ask the questions that you want to ask. You get to have that one-on-one time, and your treatment session is 60 minutes to 70 minutes typically while you're in here. And it's really important that we get your hands on you and we start working the joint. But then it's just like we talked about function. We got to progress to those things. And the people that want to come in for the massages, they just never get to where they need to go in the long run. We treat a variety of conditions in terms of demographics. So we have foot ankle patients that are here. We total knees, hip patients, pretty much everything. We are seeing a lot of patients post-COVID right now. There's a lot of deconditioning that we're seeing with patients.
I've noticed that.
Yes. So we're getting a lot of referrals from our providers to asking us to help recondition them and get them better. So we're seeing that as well. We treat vestibular patients with dizziness, so very wide spectrum of patients that are here. But again, creating that kind of therapeutic alliance, and I want people to be comfortable with coming to me for a musculoskeletal issue. And I think we're seeing that in healthcare a lot too, where more and more people are choosing to go to physical therapy first, besides going to their primary care physician. If they threw a baseball and hurt their shoulder, a lot of times they're choosing to ask, what's going on. And with us having a doctorate level profession, we now can triage those patients, so to say, and then no, you need an x-ray, right? You need to go have this done first before you come back to see us.
Do you have to have a referral, or can you go straight to PT?
You don't, depending on your insurance.
Okay.
So there are some insurance plans that require us to have that. But what we feel, even though we have direct access laws here in Kentucky where we can see that patient, we want to get their primary care physician involved. We want to get you involved. We want to make sure that if there's imaging that's needed, there's injections that are needed, if there's other things, if we have a team effort going on, working to get that patient better, I think that's the most important. So if we have somebody that comes in that is direct access and says, hey, I've got this hip issue, can you take a look at it? Certainly we'll be involved and we'll look at it, but my first questions are, who is your doctor? Let's make sure that they're looped in so that they can understand this as well.
Perfect.
We're located here off Sir Barton Way. We are next to the Lens Crafters. Crumbles Cookies has just gone in as well.
That's
the go-to place for everybody. But if you're going into Target here in Hamburg, you'll drive right past our location. And then, like I said, we're open from 8 to 5 Monday through Friday. We accept most insurances. So if you guys would like to schedule an appointment, you can call. If it's easier, you can go on the website and you can request the appointment as well, and then we'll call you and schedule the appointment.
And so 2160 Sir Barton Way, Suite 146.
You got it.
Oh, okay. And his phone number, if you'd like to contact him, is 859. Oh my God, this is the easiest number in the book. 300-0440. All right, guys, thanks for watching.